see all the panelists here.
मी लागेल तेव्हा सांग चालू करा.
Good evening.
Good evening.
Good evening.
So great to be back on, roundtables. Roundtables are always so much fun and let me.
Right. Okay.
Right. So all of us are there on the screen, right? Yes. So a warm welcome to the NJH family, the insiders and the extended family, everyone. We welcome you to this yet another roundtable wherein we discuss about various illnesses and how homeopathy helps in that. Yeah, it gives me a lot of pleasure in introducing this amazing panel, all from different parts of India. So today we have Dr. Sunita Nikum, who is the psychologist here, right? Sunita, just
Psychiatrist.
Psychiatrist. Yeah,
Homeopathic psychiatrist.
Homeopathic psychiatrist. Yes. So, I would let us do it little differently today rather than me introducing each of you. Why don't you all say one or two lines about yourself today? Can we do that? Do you think, is that okay?
Sure.
Okay.
Yeah. All right. Let's start with you. So in no particular order, I'm just starting with my screen. Dr. Sunita, if you can introduce yourself, tell us where are you from today, and we'll take it forward from there.
Okay. Today I have accessed this website from Thane. I practice at Thane. I am associated with ML Dhole Institute, Palghar. I'm working as a head of the department in the homeopathic psychiatry, and I look after the child psychiatry OPD. I'm consultant to the OPD as well as general psychiatry. We at Palghar try to manage most of the psychiatry cases of general and the child psychiatry with the homeopathy. So we have a IPD of 20 beds, we have a de-addiction center, we have a geriatric home, and we try to manage all the cases which has a psychiatric component with the homeopathy.
Amazing, Dr. Sunita. And let me tell you, friends, she is an amazing friend. So I've learned a lot from you, Sunita. And so I'm just looking forward to knowing and enriching myself today with your rich knowledge. So thank you so much for being here today. Dr. Mithal Joshi.
Hi, I'm Mithal from Ahmedabad. I have been practicing since 2002. I've had experience with autism with Dr. Barvelia sir for about 2 years.
Wow.
In his Spandan center.
Amazing.
That was a bit back, yes. But then since then coming to Ahmedabad, I've been dealing with various cases that come to my clinic.
Amazing, Dr. Mithal. This is your first roundtable?
Second.
Second. Okay.
Yep.
Yeah. The one where I was absent.
Yeah, the one where you were not there.
Right. Wonderful. So happy to have you, Dr. Mithal, here. And yes, Dr. Ketan Shah.
Hello, good evening, everybody. Myself, Dr. Ketan Shah. I am from Ahmedabad, Gujarat, same from Mithal place. And I am practicing since 33 years, since 1989. And I am attached with Ahmedabad Homeopathic Medical College as Professor of Materia Medica and PG and PhD guide for the Parul University and many others universities.
Amazing. Sir, very happy to have you. And, the one thing common which me and Dr. Ketan sir share is our clinic name. My clinic name is Happiness Holistic Clinic and his clinic name is Happy Homeopathy.
Right.
Yeah. So wonderful to have you here, sir. Dr. Yogesh Niturkar.
To one and all, myself, Dr. Yogesh Dhondiraj Niturkar. I am basically from Latur. I am alumni of Dr. ML Dhole Memorial Homeopathic Institute, Palghar. and I also share a common thread with Mithil Madam. I was also fortunate to work with PMB sir, and the first camp that I had attended that led the stimulus to be a part of this sector, intellectual disability, and then the disability sector itself. I'm a homeopathic consultant. I'm a lecturer at Vasantrao Kale Homeopathic Medical College, Latur, since 2006. And right now, I am holding a capacity of secretary at District Disability Rehabilitation Center, Latur. Implementing agency is Samvedna Cerebral Palsy Vikasan Kendra, and I am functioning as a joint secretary over that center. Side by side, I had been given a responsibility of State Nodal Agency Center as a coordinator for Maharashtra State, which is under the Ministry of Social Justice and Empowerment for the Persons of Disability, Government of India, under the National Trust. So right now the autism is there. So I will be playing a different role here in terms of making people aware that what kind of schemes are there. I will little bit means I will be not more focusing on the homeopathic aspect, as three of my panelists will do justice for that. That's what I have to say right now.
Amazing, guys. I mean, I think today my decision of not not me talking about you guys was right, because I did not know all of these things, right? I never knew that Dr. Mittal has worked in Spandan, which is so apt for today. Like today, your experience with Dr. Balwalia, like he is Bhagavad Gita of autism, I would say. You know, if anybody wants to understand anything with so much earnestness, he has to go to Dr. Balwalia. So happy to have you all here. And Dr. Yogesh, yes, absolutely. All the challenges which autism faces, there has to be some skill development, and the various schemes which the government floats, most of the times people are not aware of that. So as a doctor, definitely, if we are able to add that to their, knowledge, then definitely that's one of the best things. So without wasting much time, I would directly, let's just start with, how do you diagnose autism? How do you come to know? Because nowadays what has happened is a lot of terms are used very loosely, like, dyslexia or ADHD, or, I have a, like, you see somebody misbehaving, or you see somebody not doing his work properly, and randomly these teenagers nowadays can stamp some children. So let's not get into that, why it happens, but let us just identify for ourselves as to, where do you diagnose, where do you come to this diagnosis, right? So should we start with Dr. Sunita, because you are the psychiatrist here? So should we start with you?
Okay. uh, See, when you're talking of autism, before diagnosing the autism or any psychiatric condition, we need to understand what has changed behavior in the child. Because unless and until you are unable to notice that, you may not be able to go ahead with what kind of a investigation, what kind of a ancillary measures, or what kind of a doctor you should be looking for. See, I'm talking doctor from which this point of view, where the people may not be able to understand whether they have to go to a pediatrician, whether they have to go to a psychiatrist, or whether they have to go to a therapist. What is that? So, as a homeopath, when I'm speaking of, so and the patient comes to us with the faith, so what kind of a behavior has changed from normal, and which is probably disturbing the family and disturbing the child? So, after having the assessment of the altered behavior or a changed behavior, we can go for the diagnosis purpose. So, the behavior, if you want to see and the level, the child will not be having a good social communication. He may not be interacting well with even the family members, leave apart the other extended family. So, these are the hallmarks. The even the repetitive behavior, even the repetitive talk, some kind of a gesture the child will be throwing out, which is probably not going in hand with his developmental years. So these are the, you can say, key markers or red flags we need to identify, and based on that, we can diagnose the child. And before labeling to the autism or ADHD or dyslexia, you need to send a child to a psychologist who will test objectively, will perform the psychometric test, and he will diagnose. So in the disease per se autism, there are two significant psychometric tests the psychologists conduct on children. One is called as the autism rating scale, and another is the CARS. One is the Indian version, and another is the American version. So both the versions are available in India, and the psychologists basically that decide which version to be used. So after having the symptomatology and the classification of symptom, the change behavior, and getting objective evaluated by the psychologist, we can diagnose that this patient or this child is suffering of autism. And it is a syndrome, so you can get a varied range of expressions at the emotional level, at the physical level, and at the communicating level. Some may have limitations in communication. Some will have a very monosyllabic tone also along with the behavior. So wide range of expressions you are able to see.
How early can you see the symptoms, Sunita?
See, earlier we used to say that after age of 3, where the certain physical maturation according to the age, if the child has achieved. But nowadays, even by the age of 2, you may able to identify the behavioral issues in the children. Like how when the speech, the child is the speech milestone, the child completes to some extent. See, by the age of 1, some may start speaking one word. By the age of 1.5 and 2 years, the word count increases. But if you are unable to find that increase in the word count, you can suspect that. Even the pronunciation of words, even a communication with the mother, touch with the mother or a touch of any family member, if the child is averse to. So these are the again the red marks or flags we can identify. So by the age of 2, we can say that this child may have some behavioral issues, and we can go for the diagnosis.
You know, so many times, even if we know the disease completely and all, we struggle with why of it.
Yes.
Right. So if Dr. Mittal can talk about a little about, etiology or what are the risk factors and why does it happen? I mean, most importantly, the parents who get these children, they will be questioning themselves as to why me? Why should I only get it?
Yeah,
right?
That is so true. And going forward with Dr. Sunita, as she said, autism is autism spectrum disorder, right? So it covers a lot of hyperactivity, temper tantrums, poor attention span and concentration with language and communication issues. Now, these behavioral and communication problems may stem from rather internal more than external factors. So there is a study that has been undertaken by neurologists. They say there is a correlation between Fragile X syndrome and tuberous sclerosis. At the same time, neurologically, there is a decreased development of the forebrain and the limbic system. And the Purkinje cells are also very less in number. Along with that, there is age-related differences. If you can see between the cell size and the cerebral nuclei, you see that it is a dynamic process. It is not a stagnant disease. It is not one time you get a disease and it will remain, the MRI will remain the same. It will, as you go on with the age, it changes. Exact etiology is difficult, but the factors that can influence can be divided into multiple parts. One, if you consider the conception factors, the parental age, mother more than 40 years, father more than 50 years. And during pregnancy factors, if you consider, then there is a mother's metabolic health. That is also very important. And even that, just a sec.
Have some water. So somebody can, Sunita, if you can continue.
Can I add?
Yes, please, sir.
Yeah. So why this autism. So there are many theories you can say. First is genetic. If some genetic trend is there, there are most of the chances. Earlier, people used to give this medicine for morning sickness during the pregnancy. That also can create the autism. Even as this Mittal told that because of the brain development, forepart or posterior part, there may be some chances of that. Apart from this, age or even environmental, if pollution or some people said that vaccination also play a major role, but some people deny for that also. MMR vaccine also one of the cause. So cell arrangement in brain is maybe one of the cause. And one more things that I want to add that related to our organ on our Honeyman sir, that people used to treat syphilis, they use mercury. And this mercury also create a major role. That these all are theories, but we can't say this is the, but there are so many theories.
Absolutely. So, in fact, the studies have also showed that familial history of autoimmune diseases. So, when we take the family history, or mother having some kind of psychological problem like depression or schizophrenia, or mother having stress during pregnancy, just simple stress, even that has been connected with the autism. Just other day, before I think before around 20 days, we had patient in the clinic. The twins, a set of twins came. They were born during the COVID era, and they themselves got COVID. So they were so much isolated, and they were not allowed to mix with anyone. Now this has even we have observed that it led to autism. It is because of social deprivation that caused the disease, right? And if you consider stress, then in our clinic, if we see the data amongst the autistic kids, around 60% of them, the mothers have some or the other kind of stress during pregnancy. Now, this stress has actually two kinds of effect. One, it reduces the uterine blood flow, leading to hypoxia, and the other is that they say that cortisol level transmits the placental barrier, which leads the child develops this stress kind of effect, which should not have happened. So even that has led to, that has the connection between the autism and this etiology. At birth, if there is preterm or low birth weight, or if the kid is large or small for the gestational age, even that is connected, or you can correlate with the autism. Then there is another one. They said refrigerator mother. I have just recently understood that part. That the mother who is very cold, maybe because of career, maybe because of her problems, maybe because of anything else. So if during the developmental age, if the mother is not warm, the chances of child having autism increases.
Wow. I'm frozen by this word, refrigerator mother. My God.
That is very
Yes,
true.
Dr. Sunita. You unmute yourself, Dr. Sunita. Dr. Sunita, you're on mute.
Okay. Whatever the factors Dr. Mittal and Dr. Ketan has elaborated, they're absolutely right. And this is the reason why the autism is called as a neurodevelopmental disorder. So it is along with all this factor when the brain is unable to develop in an expected way along with the whatever the neurological system it should have. So because of this neurodevelopmental part, we are able to see lot many changes at the intellectual level, emotional level, behavioral level, and the other even the education or intellectual part of it. So it's completely related to the neuro and the developmental part of brain. Yeah, I just wanted to add that.
Yeah, I would just like to take further. The Rehabilitation Council of India states about autism that it has been observed in well-adjusted, happy families, as well as it has been seen in families having unresolved emotional conflicts. And it says that irrespective of any socio-economic or religious section, it can be seen nowadays. As Mittal madam had said about 40, I would just like to correct it. It is about
Yes.
35. Mother having above 35, there are the probability of having an autistic child is there.
I didn't know
And
that.
what she had mentioned, that refrigerator mother, definitely if the mother is cold and that not much excited or not interactive during the pregnancy period, and if she is keeping her emotions or if she is self-absorbed, Kanner, it is also called as a Kanner syndrome. Kanner was the pioneer who had mentioned about autism.
Autism.
And he mentioned that autism is self-absorption. So from homeopathic point of view as well as psychological point of view, those who are self-absorbed during that phase, that is why in our Indian ethos, the Garbha Sanskar is having lots of importance. And nowadays we had seen that the self-absorption is in terms of the mobile. So that is also one of the area of concern, where the digital addiction has to be reduced, especially during the pregnancy period, if we want a healthy community in the upcoming years. And the concern of worry is that nowadays 2 in 500 cases, the autistic child is there. Next, about the diagnostic tools, DSM-4 edition is again one of the thing where we have 5 edition. Then the ICD, International Classification of Diseases, 10th edition. Then Childhood Autism Rating Scale, and another one is RCHAT, Modified Checklist for Autism in Toddlers Revised. So these are the 4 scales which are internationally accepted. Even Indian social autism scale is also there. So that is also developed by the National Trust, that is from Government of India. Neurodevelopmental pediatrician is the new specialty that is there, where nowadays in metro cities, parents are concerned about whether my child is developing in a normal way or not. So that can help us in early diagnosis. If there are district early intervention centers, which is supposed to be in every district, the autistic child can be identified by latest by the 18th months of his or her age.
Yes.
So the early detection, identification will have a better prognosis. That is what we have to add. So DIC is under Rashtriya Bal Suraksha Karyakram, Government of India. Under that we can find out.
Perfect. So I agree with you, Dr. Yogesh. Even a child of 8-month-old, if he is not responding to emotions, any happy emotions or sad emotions, or there are no expressions, even when the mother is hugging, that time if the child is not smiling, so you must start thinking about whether what is wrong. Maybe we will not stamp that child at that age, but you must start thinking. And an 18-month-old child, if he's not excited to show you something, then definitely you have to think about assessment. And rightly said by Dr. Yogesh that early detection will definitely help. Now the homeopath inside me is itching to know what is the psychodynamics of autism. We have understood mother's mental state during during pregnancy has to be understood. But then, the why of it as a homeopath, what can we, what is it that they're blocking out? Who would like to take this?
See, autism is basically, as Dr. Niturkar said, it is a morbid self-absorption, right? So self-centered fantasy or thinking. So basically, the thing is that they have this unique sensory processing mechanism. They see the world different than what we see, and they understand it differently, and they communicate it differently. Because we are greater in number, we have the tendency to believe that we are the norm and they are special kids. It is just the difference that is the basic, more important thing. That it's like you see yellow and I see green. How is that going to make sense? Right? So the sense, what you say is what is basically psychodynamics or mechanism is, it's the difference in the way they perceive and the way they communicate. Right?
This autistic child can see, can hear, but the process in brain, that's not working. They can't understand. So problem with that brain analysis.
Okay. Yeah, Dr. Sunita.
I would like to correct the term psychodynamic. So when you are talking of a psychodynamic, that means the illness which has resulted because of some issues with the self, either thinking or either because of some maladaptation. But autism is not resultant because of the self issues or a self maladaptation. The autism is because of certain problem either with the mother, either with her emotions or genetically, what we have already talked of. See, even we have seen the mother who has a first child normal may have a second child who can develop ASD. So it is, since again I am highlighting this word neurodevelopmental. So psychodynamic, this concept may not be applicable to the patient. It may applicable to the mother. As Dr. Mittal has rightly said, the refrigerator mother, or Dr. Yogesh Niturkar has talked about the self-absorption. So this could be on the part of mother, but not for the child. Child has become a victim of whatever has happened when he is into process of develop right from the womb, because he already has some asthmatic load which has come from the both the parents, some environment when at the time of conception, the mother who is not responding to that, or even certain habits of mother, some addictions also can result into this. And as rightly pointed out by Dr. Ketan, even the vaccination, the role of allopathic medication can cause the disturbances in the normal development. So psychodynamic, this concept will not be applicable to the autism spectrum at all. So we have to be very particular about this.
All right.
Yeah,
So
this is
now-
what I want to add. Yeah.
And their understanding and reaction to that understanding or perception is as per their own pace
Yes.
and their actions. Only it is the patience that we should have to understand that. That is what it is needed. They will respond, but they will respond it on their own natural way of expression.
Okay. So, now that we have discussed, not into details, I would say, but now that we have an overview of the illness, can we share cases? Very quick cases. I know it's going to take long, so maybe we'll just take one case today.
Okay.
Yeah. Yes, sir.
One of my patient, that's 15 years old, and he took so many treatment before consulting me. And six months, he's under my treatment. And within 6 months, there is marvelous improvement. हम बात करते हैं कि अगर छोटी एज में डायग्नोस हुआ होता है तो छोटी उम्र में ही दवाई शुरू की होती तो अच्छा था. But after 15 years and within 6 months, very promising result from that child.
Wonderful. Sir, can you share some glimpses of the case?
Okay. This patient is very sensitive to noise and stranger, and you can say I prescribe Bufo because that's body, this patient height body is very well, but mind is not developed. You can compare Bufo with Barataka, but Barataka physically and mentally dwarfish. And this Bufo patient physically strong, but mentally that's dwarfish. So this patient started self-hurting, biting from the noise, and on this basis, and in Bufo there is also sexuality part is there. So I prescribed Bufo, and within 6 months, and I prescribed in LM potency also. So within 6 months, these patients improve very well.
Wow. Very nice. Dr. Mittal?
Actually, I would like to share a case of a boy who came to us when he was 7 years old, right? He was diagnosed with ADHD and autism. The moment he came to us, like, he was not sitting still at all. And the teachers, the school said ADHD, then they got diagnosed and it came down with autism. He would not sit still. He would, teachers would have to repeat the commands, would play with fingers, loud flapping of hands and moving up and down the lift. So classic autism symptoms were also there with him. The unique part was that along with all the symptoms, which are very common to the disease per se, he was constantly singing in the cabin. That went on and on and on. On that basis, we prescribed him lachesis. Right? It has been 2 years since he's there he's a clinic patient and he comes for the follow-up. Just my luck that just day before yesterday, the mother came for a follow-up and I got the exact picture of what is the situation now. So now the flapping has reduced, the constant singing has stopped, then his hyperactivity is reduced. Now he's sitting and listening. He obeys the commands. His focus has increased. The unique part was that he still likes to play with fingers, but now he's very sly. He would see whether the mother is there looking at him or not, and then he would play with fingers. I told you that the mother, that now the kid is becoming more and more regarding Nihal with as like the other kids. I would not say normal, but like the other kids who is sly, who is mischievous, and now trying to create his own
Play around.
enjoyment. Yeah.
Wonderful, wonderful. Yes, Dr. Sunita.
We have lot of cases. What I wanted actually in the today's session, what I wanted to highlight, ki once the autism is diagnosed, what next? Because the patients are coming to us at multiple age, multiple level of problem and the intensity of problem. So every homeopath will treat as per whatever experience he has of treating. But once you diagnose, being a homeopath, what is next? So what I would like to highlight 4 or 5 points over here. If we are treating him medically, so what kind of a medication is required, whether and how long you will continue the medicines? Because every time we discuss autism spectrum, we discuss cases. But now this is the point we should go a little ahead so that the audience also will be benefited with that. So
Absolutely.
because, and even with the experience, positive experience with the homeopathy, the patient do stick to us for a longer duration of time. But we have to decide for how long the patient should be given treatment, whether he will be given the same medicine for years together, whether what role the intercurrent will play into that, what kind of a schooling the child will require, whether the schooling he can be accommodated into normal schooling or he will require some special school. If he is going to the normal schooling, what kind of a certification he would require. I think Dr. Yogesh will speak about it, how the schemes and other things are coming up. But after the schooling, then what about his ancillary therapy? Whether he will be going for a single therapy of a speech or a occupational, or it should be a combination of therapies, because we also have to decide about it. If all these things are we have tackled, then what about his social interaction? How the child will be or a family will be motivated to improve this social interaction? Because all the parents, they are expecting guidance from us. They have a total faith on us, and that is the reason ki what next, that was actually my today's point of discussion or a talk about it. Then after the social communication, as the age advances, their with the physical growth, their sexuality, their hormones upsurge is also changing. So how you will be handling that, identifying that, how you will be orienting the
So,
parents.
Dr. Sunita, why don't you take up one of like 4 or 5 of these pointers and guide us about it?
See, the one case definitely I would like to share, because that case we have published in NJH
You were
also.
telling about what next. So why don't you
Yeah.
tell us a little more about that?
That's why I'm trying to tell you, because this case, it is there in the NJH. And I
Okay.
have published that case when these issues were not there. See, we have identified the autism at quite early age. We have treated the autism. But once the patient still coming to you with a different shades of problem, how the autism can be dealt.
Yeah.
because this issue may be coming to each and every homeopath now and then, or
True.
it may come in their future practice as well. So
True, true.
how this roundtable conference will benefit the participants also and will benefit the audience as well. So the case which I'm talking of, the case was of a girl. When she approached us, she was 7-year-old. She was diagnosed, then she was treated, she was given nitram carb. But as the days advances, though her social communication has improved, but how she should be mingled with the class teacher, the class schoolmates, that was really a very difficult task. So at the intellectual level, she was performing very well. For self-absorption, that has reduced, the repetitive behavior has reduced. But to communicate with the fellow students or fellow mates, it was for difficult, very difficulty for her. So we asked parents to have a mock classroom in the house where the mother can be a part of will play a part of a fellow student or this thing, where the child has to communicate how she is talking in the school. So that kind of a training we had given. The same child, when she has now become of a say 14-15-year-old, now she has started menstruating, then how she should be taking care of it, whether she will be understanding that, how she should be made understood this is a normal physiological discharge, because they are so sensitive to all the sensory inputs, even their self body part also. So how she will be using the sanitary pads, that was really a challenge. So how again you will make the child to learn about all these things. At the same time, the parents were also worried about, because now the child has started going to the school independently. So how she should be going to the school, what kind of a safety she has to follow. See, all being a female or being a girl child, the parents really start thinking of so many other issues and the lateral issues for the child. So you have to be very well in advance with the time, and you have to project that this kind of a problem can come up. So this particular child was told how she should take care of self. Though she is very self-protected, being having autistic trait now, but still anything can happen in today's world. We cannot really give guarantee of anyone around. So how the child should be taught was challenged. So we have taken a help of a counseling psychologist at that particular time. Child was oriented about all these things. I think the Dr. Nirupama, if she's attending, then probably she might have experienced this kind of a challenges. When you are counseling about the menstruation or about the sexuality and the sexual change, even the normal children may have. So explaining to the autistic child is a very, very difficult and a very hard task. So in that case, we have faced all these issues. At some particular time, the school was not ready to allow her to with the normal schooling. So they wanted the certification. So who will give the certification? Whether that certification will be valid, not valid. So all this issue we have experienced in multiple cases. But since this particular child was there since the age of 7 till today, so all these issues were identified and dealt with the expert of that particular field.
So to sum up what you said is, if
Ah.
correct me if I've understood it correctly, we need to plan out the entire growing up of the child, and we
Yes.
need to have a proper plan in action. So
Yes.
there can be a possibility of involving a consulting psychologist and or maybe a social service or an NGO or somebody who's working into this, and maybe
Yes.
we can take help of a what do you call it, occupational therapist also, who would
So
be
it's a
better
holistic
equipped.
management we have to plan.
Yes,
Yeah.
yes. So it can never end with just deciding the remedy,
Yes.
but there are
Yes.
so many
Yes.
other means wherein the
Yes.
parents are going to require our guidance. So we
Yes.
must have to think about it first. Amazing
Yes.
point, Dr. Sunita. Really amazing.
Yeah.
I think that brings us to Dr. Yogesh, and you can talk about various schemes and how we can add value to their life.
Hello, Dr. Rushali.
Yes, sir.
Every time you ask 2 cases.
Yes.
So today
You
also I
prepared
will tell 2 cases.
I love it,
Because
sir. Thank
this
you
is
so much.
this is obsessive. And in autism also, they fix they fix time,
Love it.
fix choice. So I will also fix with 2 cases.
So should we
allow
sandwich
you.
it, sir? We will keep your
We
MUFO
will allow
case
you.
first. Let us go, Dr. Yogesh. Let him talk about it, and then we'll take your case again. So we'll just bring it
The madam,
together.
yes, Sunita madam has rightly said that it is a management planning, or what we can as therapeutic planning of that child who grows up into an individual, and we have to handle. We have to remember that it is an umbrella term. Autism itself is an umbrella term where we have to deal with multifactorial aspects of that individual as a
Yes.
whole. Another thing is in terms of that it is a state which is permanent, either ranging from mild to profound, and that we have to manage with remedial as well as non-remedial measures. We have to remember that. So when we are talking from that we had received a wonderful result or we had helped that child, I would just like to focus upon from evidences that we should have before and after. When we are having any sort of intervention, we should have some outcome assessment criteria for that. So whether we have done CARS, whether we have done the chat scaling, or whether we have followed Winled social maturity scale, so it will help us in terms of standing out with more evidences. There is another thing, autism treatment evaluation checklist, that we should also follow so that we can confidently say that this kind of change has been there. And these skills are either to be filled by the physician or the treating consultant, or it is something which can be taken up with the help of the parents also. Sunita madam was talking about a teacher. So it is called as a shadow teacher. The concept is of shadow teacher, which will help that child to bring into mainstream schooling. Another thing is that the hormonal levels needs to be assessed from time to time. So whether the child has become hyper or hypo, so what kind of things are there? So we need to understand that also. Another common thing is that the autistic child are very prone to have some sort of epilepsy, any type of epilepsy. So that is also one of the major area of concern that we need to deal with. And when the autistic child goes into puberty, then the handling of that pubertal age is very difficult. So at that time, they become more expressive, they become more violent, hyperactivity is seen in these children. So we need to understand that point also. And it is more common in males as compared to females. 4 times it is more common in male rather than the female. Madam has raised an issue that menstruation. So it is very rightly put it out and nicely put it out that it is very concerned issue that we are also facing, that when they have to be shifted to a age group home, what we call as group home like Garonda, because before 18 and after 18 there is a drastic change. How to handle these children at home when parents have given up all sort of hope, and how to deal with these children. So there are skill development schemes, there are centers where we can put up these children so that they can remain engaged. So before 18, there are daycare schools, which are special rehabilitation schools where we can have physiotherapy, occupational therapy, speech therapy, as well as neuro checkup, medical checkup. And when there are means where there is no cure, there are 100 modalities that can be applied in such cases. So at one place we can have such kind of centers like we are having at Samvedna, where we have all sort of facilities available for the management of such kind of children. So I would like to focus upon that. The Niramay health scheme is there because they need different schemes, different therapies. So for that, for 1 lakh of benefit, you have to pay just 500 rupees. And under that, transportation cost is there. Non-surgical hospitalization stays are there. If he needs some surgical corrections, then that also facility is provided in that scheme. And therapy cost is also covered in that. So I would take up this platform as an opportunity to inform the listeners that Niramay Health Scheme is there under National Trust, which is having only low premium of 500, irrespective of age, irrespective of the type of intellectual disability. and we have made an attempt that the premium will be paid by the district social welfare office. So we mobilize that fund from them out of the reserved 5% of fund, and we pay the premium. So this is one thing that I would like to add. Another is Garonda, group home for intellectual disabled persons, where skill development and vocational training is provided. It is a residential school, a residential training center. So that is also good for such children. You can advise that to your patient that if they are having such kind of residential training center, so that the person, that the child can be engaged, and the level of frustration or depression in parents will also automatically reduce.
Right.
So evidences are crucial in justifying that yes, our remedy has acted. Definitely there are many stalwarts in homeopathy who are working marvelously. To name a few, we have Dr. M.L. Dhaule Institute for that. Spandan Institute is there of Barwalia sir. Vijayakar sir is also working in this field marvelously. Our friend Samir Chaukar is also working in autism. Hema Parikh madam is working in disability sector. I am also working.
Cerebral
Bhaskar
palsy.
Bhatt sir is also working in that. Ketan sir, everyone is having, at least I would say, every homeopath, at least he says one autistic child nowadays.
Absolutely.
That is so frequent nowadays.
Absolutely true. So, you know, I will
need to update. We need to update that this is a state which needs to be handled from multiple angles.
right. Very
it is
rightly
a
said.
holistic approach that we have to understand.
Yes, absolutely. So now, you know, in this light, Ketan sir will like to take your case and then I will sum it up.
Yes.
We even Sunita madam talk about we have to observe abnormality, but first we should know normal. At what age patient start smiling, or at what age patient start speaking, walking. So if we know the normal value, normal age, then we can decide that this is the late learning or late speaking, like that. And in this autistic child, they never give symptoms directly. So observation is very important in this case. Even I ask my patient's parent that you should observe and tell me if any abnormality or whatever your observation, share with me, because observation is only important in to treating this type of cases. And now I am sharing my case. That patient, this 2 or 3 years old child, that walking on his toes, and walking on toes is also symptoms of autism. And this patient is very irritable, biting, and when this patient become angry, he strike his head on the wall. And we have a direct rubric that walking on the toes. Crotalus horridus is remedy, belladonna, letherus, nitric acid, sickle core. I don't know except belladonna and letherus. I don't know how to this convert Crotalus horridus for this type of walking on the toes. But with its angry nature and head striking to the wall, I prescribe belladonna, and with belladonna I get very good features.
Very good. Excellent, sir. So now I will also share one case which I'm treating currently for last 2 years. And this is a 27-year-old girl child. And all the difficulties which Dr. Sunita mentioned, her mother had experienced. You know, her menstruation, then her sexuality, they're having difficulty. And because, you know, she does not have a barrier, basically. She doesn't know what to speak, what not to speak, so she can speak anything. She also has epilepsy, and she's from a huge Marwadi family. So, you know, there are male servants around in the house. So she always picks up a fight with them. So, she has her own ways of keeping things, or her own ways of doing a certain thing. She has a crazy idea about shopping. So she sees Instagram reels and she wants to shop every single day. So that is her compulsion, and she was having very frequent epilepsy when she came to me, because her mother said, autism, we know she has this and we are not worried about it. We can't do anything about it. We are tired now. And now what we want is only cure for her epilepsy, because every 2 weeks she was getting one attack. So I started treating her. Her epilepsy reduced based on her overt sexuality, and she used to abuse people. Like, she would give very bad abusive words to her grandfather, paternal grandfather. So she had no filter. So then I had given her lachesis, and that reduced her frequency of epilepsy to from 2 weeks to 6 weeks. It has gone now. So, and past, in fact, 3 months, there are only prodromal symptoms of epilepsy, but no epilepsy. So that is her result. The best part was her grandfather sent me a note that there has been 1 week where she did not abuse him. So that was a very big improvement. And this girl has been now, there is a course for them. Like, I don't know about the scheme. I had no idea about the schemes which Dr. Yogesh mentioned, but she has done a course on, Amazon has a course wherein Amazon hires these children to manage their store. So, simple things like their orders are to be picked up from one place and to be kept at the other. Very small packets, not very heavy things, but Amazon hires, because these people can do, if a task is explained properly, they can do that repeatedly and they have no problem in repeating that task. So these are the kind of jobs which these children can do. So this girl comes from a very affluent family, but still she works in that Amazon warehouse, because it's a good point for the family. So I would definitely include a lot of factors, because I have very less experience so far with autism, just a few cases. But I think this is amazing. Today's session, if I have to cover it up, to sum it up, yes, Dr. Ketan. Yes, sir.
If Amazon have a bigger or heavy packets, ask them. We have agaricus patient. Agaricus patient is fearlessly and they can lift heavy load.
Heavy loads also.
For small packets, other patients are there.
Other
But
patients.
for heavy weight, ask them that they pick up agaricus patient. And one more thing, Dr. Praveen Kumar wants to send some message.
Praveen sir has sent a message.
Yeah, want to share anything or what?
Hereafter, I would send intricate cases of autism to one of you, but to whom among you? Sir, you can send one case to each of us.
And try.
We would appreciate that.
You can try.
And every week is fine. And yeah, refrigerator mother, that term has just struck to me, Mithil, because this girl, I'm treating her mother as well. She's a thin lady, but she has varicose vein, very thin lady all throughout her life. And when I defined her case, I've given her, no prizes for guessing. CPI. Yeah. So, everything is just getting connected for me. That, how it can go. So what are the take home messages? We just have 3 minutes left. So I'll just sum up today. So first and foremost.
Sorry to interrupt. I would like to just add a homeopathic part, because it would be injustice from my point towards my homeopathy. Oral hygiene, salivation, hyperactivity, and the recurrent respiratory infections are major area of concern, where we can deal with borax, Merck salt, depending upon the stage of susceptibility, as well as tarantula is very well indicated. Then the pulsatilla R-sulb is also very well indicated in such cases. And these children are fearless. So the weight and all these issues are not to them. Another thing is that many countries are now recruiting these autistic divine children for their security systems, so that they can keep a close watch, and whatever is not regular, they pick up. And the human resource department has very less things to work upon them. So that is the advantage of my divine autistic children. So they are definitely contributing to the society directly or indirectly, and we are here to take care of them.
Wonderful. That just reminds me of a quote from an author. I'm forgetting the name. Yes, Dr. Sunita. Go ahead.
See, this is a little addition, because throughout, even I am the part of it. Throughout our today's discussion, we have used autistic children. But from the stigmatizing that particular term, nowadays, what people are expecting, they should not be called, or any psychiatric person should not be called as a psychiatric case, but they should be termed so and so is having so and so disorder, like XYZ girl is having or suffering of autism. So henceforth, we should take care when we are communicating on a larger platform. We should avoid this stigmatization, autistic child, psychiatric case, depressive case. So henceforth, we should be very careful in using the term, so that again we are promoting one type of a destigmatization in the community.
Very beautiful, Dr. Sunita. It's really amazing. So, I always use it for other occasions, but I've missed it today. Like, you're not a procrastinator. You have a habit of procrastinating. So that
Yes.
just immediately desensitizes the person.
Yes.
So when you have a habit, you can treat it. Similarly, when you have a certain syndrome, you can treat it. You can't become that syndrome. So very well, very well.
Nobody
pointed.
likes labels.
Yes, there
Yes,
should not be labels.
absolutely,
There should not be labels.
absolutely.
Yeah, beautiful. So, so the quote which I was mentioning from an author, the author I don't remember, but I remember what she said. God gives me problems only to those people because they can handle it. Why of this is because, the child who has autism comes to only that family who can handle it, or probably that is the fit. That is what it needed. And it just reminds me, one of my teacher, Dr. Jayesh Shah sir, he always mentioned that this is not a problem actually. Autism is a solution to that family, because when one person has autism, the entire family gets glued together because they are now finding a solution to this problem. So, the family which requires binding, there comes a child who has autism in that. So it could be one of the ways of looking at it. Dr.
Dr.
Mittal, disagree?
Vishali, I would like to agree to your statement, but I have just had a case where the parents divorced after the diagnosis. So yes, we also see this
And
kind
this
of
is very
situation.
common.
Probably
This is
they
very common.
require divorce for,
Same
maintaining peace.
Marital disharmony is very common because of various
Because of
types
the
of
sick kid.
disabilities.
Yeah.
Yes,
And
yes. So,
we have
and
to work upon that angle also.
yes, yes. So, let's just sum up quickly what all we discussed today. So first and foremost, before diagnosing, there are so many factors which we must take into consideration, and we must look into different scales which are available. The 4 scales: autism rating scale, CARS, and which are the other? Chat and social rating scales. And most important part is, even while you are treating a patient, you must fill up that scale one more time before you claim that you have treated it. Very, very important. Once you define the case, like how a homeopath takes into consideration about miasm and what remedy to give and what frequency of repetition and other things, similarly, you must chalk out an entire detailed plan for this individual, taking into consideration about the pubertal changes which are going to come, or the socio-economic changes which this child is going to face. So we must plan everything. we also have to look at it from a neurodevelopmental difficulty, wherein we understand that these people have developed in a different manner. Whether they are normal or we are normal, only time is going to tell, right? So developmental patterns we have to see. Then what we also need to take into consideration is so many factors, like etiological factors like vaccination. So we have to work harder as a homeopath, I feel, to prevent people from over vaccinating themselves. So that is also one of the things. And refrigerator mother, I think if we understand this term, and it's a beautiful term, by the way, Dr. Mittal, thank you so much. So, if we come across, I would take this on me, that if I come across such a mother to be in my practice, I would definitely work on desensitizing her, and I would work on creating a proper good mother. Yeah, so that we can maybe have avert a few future some problems. Before and after filling up of the same scale is most essential. So that is going to be my take home message, along with the Niramay Health Scheme and Gharonda skill development, which was really, really amazing. So with that, I thank each of you. And I think this topic can be spoken for hours together, but every good thing must come to an end. And so we will just put a full stop for today's discussion here. And we would definitely come back with a few more insights into it, a few more things, few more cases maybe into detail. And maybe one of you, I would invite one of you to have a full webinar on autism, wherein you can, discuss everything together. Maybe Dr. Sunita can take this up, and we all will help you with that. How do you think about it, Dr. Sunita? Yes, you're on mute. You're on mute.
Definitely. Actually, in the month of April, the 2nd April, 2nd or 3rd, if I'm not sorry for that. The exact date I'm not able to
2nd
tell you.
April.
2nd April
yes.
is the autism is
World
being
Autism.
celebrated worldwide. So
Yes.
having this in the month of April was really a thoughtful idea from the NJH. This thing.
That was the thought.
Purposefully it was kept.
No, because since I was not,
Purposefully.
I was not in India, so I was unable to connect with that in the first week of April. But definitely, if you can have this kind of a webinar on that topic, and really, it's a huge topic and
huge topic, because lot of remedies also have to be thought. Like today we discussed bufo, we discussed agaricus, we discussed lachesis, and there can be many more cases, many more remedies. Tarantula,
along with the range, Just now,
Range.
I have seen one question, because the people are participants are interested to know the role of intercurrent. So how the intercurrent to be thought of, when it is to be indicated, how it is to be given, what kind of a potency is required. So many questions can come up. So again,
I'm always very happy when after the discussion we feel that we can talk more, and we've just got a in the chat box we've got a feedback that they can listen to us for hours. So yes, we would also love to speak for hours, but for today we will have to take a break. And thank you so much. I thank each and every one of you for sharing so much of knowledge, so much of information. And I thank the entire audience for, encouraging us to come up with more and more of such roundtables. So we will be back in the 4th week of May. And in the 2nd week of May, we will be back with another power-packed webinar. So thank you so much. Keep reading NJH, keep contributing to it. We will come back with more knowledge. Yes.
Thank you.
NJH Autism.
Thank you.
Yes.
Thank you.
Which month, Dr. Yogesh?
I think it's
It was October 2022.
October
October 2022.
Last year.
Last year. Yes, so we would invite you
this-
to read that
Hmm.
and contribute more of your experience in the Telegram group. Thank you so much. Stay
Thank you.
happy, stay healthy, and stay connected with NJH. Good night.
Thank you. Bye.
Thank
Thank
you.
you.
Bye-bye.
Thank you.
Yeah.